You've read the articles, tried the apps, and still your tinnitus grabs your attention at the worst moments. The right sound doesn't just cover it up, it can actually trick the brain so the noise fades into the background. I'm Dr. Ben Thompson from Pure Tinnitus, and today I'll walk you through 5 simple, often forgotten steps that together make a real difference in how loud and how distressing tinnitus feels. If this topic helps you, hit subscribe so more people can find practical tips for managing tinnitus. You're not alone if you feel stuck. A lot of people try one trick after another and get short-term relief or nothing at all. That gap usually comes from using sound without a plan, treating stress as separate from tinnitus, or ignoring the daily habits that build resilience. I'll give you 5 reminders: a sound therapy plan that uses the mixing point, ways to reduce fight or flight activation, daily stress calming practices, basic CBT-style tools for negative thoughts, and simple morning and evening routines that protect your nervous system. Each one has a short explanation, a micro-action you can try right now, and a tiny example from clinical practice. Reminder 1. Build a sound therapy plan that targets the mixing point. Most people think all sound is the same. Louder sound hides tinnitus. That's not the best approach. The mixing point is a level where an external sound sits close to your tinnitus tone, so the two blend together. It reduces the prominence of tinnitus without completely covering it. In plain terms, imagine adjusting the volume of a radio until it's close to the hum in the room. Not so loud that you can't hear the hum at all, but close enough that your brain starts to treat them as one background noise. Why this matters? Mixing point sound encourages the brain to reprioritize incoming sounds. Over time, the tinnitus signal competes less for attention, and your brain learns to ignore it more easily, a process related to habituation. Practical sound choices and how to use them. Sounds similar in pitch to your tinnitus often work well. Soft, high-frequency sounds like running water, crickets, or a distant fan can be helpful. Lower-pitched tinnitus might respond better to different textures, like soft wind or low-frequency hum. Delivery options. Use speakers in the room, a small bedside device, in-ear solutions, or bone conduction options if in-ear is uncomfortable. The right choice is what you'll wear reliably. Day versus night. During the day, use sound as enrichment to support concentration. For example, a low-level fan or soft ambient tracks while working. At night, choose gentle, non-intrusive sounds that help you fall asleep without prompting hypervigilance. Micro-action you can try now. Set a timer for 20 minutes. Start a sound you have on your phone, white noise, nature sounds, or a fan.
Slowly increase or decrease the volume until the external sound is near but not completely masking your tinnitus. That's your mixing point. Notice whether the tinnitus seems less front and center after those 20 minutes. A short clinical vignette. One client added 5 minutes of mixing point sound during phone calls and then extended it gradually. Within a few weeks, they reported better focus and less emotional reaction to the noise. It wasn't a cure, but the sound plan delivered measurable reduction in daily distress. Mini hook. Now that you have a sound plan, let's talk about what actually turns tinnitus up: your stress response. Reminder 2. Reduce fight or flight activation. Tinnitus is louder and more intrusive when your nervous system is primed for danger. The sympathetic nervous system, often called fight or flight, increases muscle tension, heart rate, and alertness. When you're chronically activated, your brain becomes more likely to amplify mild sensory inputs, including tinnitus. The parasympathetic system is the opposite. That's the rest and digest mode that calms your body. One-sentence definitions. The sympathetic nervous system speeds things up when you're threatened. The parasympathetic system slows things down and helps your body relax. Everyday triggers and bodily cues. Common triggers include late-night news, heated conversations, action-packed TV before bed, caffeine late in the day, and long periods of low-level worry. Signs you're in fight or flight include clenched jaw, tight shoulders, shallow breathing, racing thoughts, and difficulty settling down. Immediate micro-actions. Try a diaphragmatic breath. Inhale gently for 4 seconds, then exhale slowly for 6 seconds. Repeat for 1 minute and notice tension in your shoulders or jaw. When a stressor spikes your attention, pause and take a 1-minute walk. Movement interrupts the stress loop and shifts blood flow and attention away from hypervigilance. Reduce exposure to clear triggers in the evening. For example, swap late-night action movies for calm documentaries or an audiobook. Example scenario. Someone noticed their tinnitus flared after checking social media and news each evening. By deliberately avoiding those triggers an hour before bed and using a calming sound at their mixing point, the spikes at night decreased noticeably over a few weeks. Mini hook. Sound helps, but only if your body isn't stuck in fight or flight. That's why calming practices are the third key. Reminder 3. Build a daily calm practice for stress and anxiety. For many people, this is the biggest lever. Small, consistent practices create cumulative effects. The goal isn't perfection, it's daily repetition that over time lowers baseline arousal and reduces how loudly the brain perceives tinnitus. Options that work: short morning breathing or a 2-minute body scan. Awareness of tight spots in the neck and jaw is especially useful for tinnitus. A 10-20-minute walk while listening to mixing point sound. Walking combines movement, fresh air, and auditory enrichment. Evening routines like guided meditation, progressive muscle relaxation, or gentle yoga, tai chi. If formal meditation feels impossible, try single breath awareness. Count your inhales and exhales up to 10, then reset. Micro action to start today. Pick one practice and do it for 5 minutes each day for a week. For example, try a guided body scan while playing a low-level nature sound at your mixing point. Write down how your focus and mood change across the week. Professional support. If anxiety feels overwhelming or persistent, consider seeing a licensed therapist familiar with tinnitus or a CBT-trained clinician. Audiologists experienced with tinnitus can help set realistic sound therapy plans. The American Tinnitus Association is a good place to find vetted resources in support groups. Clinical note: consistency matters more than intensity. 10 minutes every day beats an hour once in a while. Over months, many people see reduced distress and better sleep. Mini hook. Calming the nervous system is essential, but thoughts also play a powerful role. Let's look at that next. Reminder 4. Challenge negative thinking with simple CBT tools. Our thinking patterns shape how much we suffer. Catastrophizing, overgeneralizing, and labeling tinnitus as ruining my life feed anxiety and attention toward the sound. Cognitive behavioral approaches help you notice those patterns and respond differently. A practical 3-step CBT micro-exercise. 1. Notice the thought. When the tinnitus spikes, identify the immediate thought. This will never get better, or I can't function. 2. Write it down briefly. Putting words on paper separates you from the thought. 3. Test the evidence and reframe. Ask, what evidence supports this thought? What evidence contradicts it? Then create a balanced alternative. This is uncomfortable right now. I've had better moments before, and I can use tools to reduce the impact. Micro-action to try now. Tonight, pause for 1 minute when tinnitus bothers you. Write the thought, and then write one sentence that challenges it. Keep it simple. This is hard, but I can use my sound plan and a breathing break. Journaling prompts. What did I notice about my tinnitus today? What situation made it worse, and what helped? What small step did I take today toward coping? When to seek professional CBT. If negative thinking leads to panic, avoidance, or persistent low mood, working with a therapist trained in CBT for tinnitus or anxiety can provide structured support and faster progress. Mini hook. Thoughts shape your experience, and routines build the reservoir that helps you handle tough days. Here's how to create that reserve. Reminder 5. Build simple morning and evening rituals that protect your energy bank. Think of resilience like an energy bank.
Small deposits each day make you less vulnerable to withdrawals during stress. Morning and evening routines are the most reliable ways to make those deposits. Sample morning routine, 10 to 20 minutes. Hydrate quickly, a glass of water to start metabolism and alertness. Brief movement, 5 minutes of stretching or walking to reduce muscle tension. 3 minutes of diaphragmatic breathing or a short body scan. Set a simple intention for the day. One sentence about what you'll focus on and how you'll respond if tinnitus gets loud. Sample evening routine, 20 to 30 minutes. Dim lights and limit screens 30 to 60 minutes before bed. Use mixing point sounds softly while winding down. Gentle stretching or a warm shower or bath. A short gratitude or reflection practice. Note one thing that went well today. Micro practices for busy people. 5-minute breathing at your desk midday. 10-minute walk with mixing point sound during lunch. Use a simple stop and check alarm 3 times a day to notice posture and jaw tension. Example, small wins add up. One busy parent reported that adding 2-minute breath checks after every diaper change or task shift helped reduce jaw clenching and overall reactivity. Over months, they felt less emotionally drained and noticed fewer tinnitus spikes during stressful evenings. Expect gradual change and normalize setbacks. Real improvement takes time. For most people, meaningful reductions in perceived loudness or distress tend to accumulate over months, not days. You may notice small wins first, better focus at work, fewer spikes at night, and those add up. Setbacks will happen. That's normal. The important part is returning to the practices without judgment. Quick recap. Use sound deliberately. Target your mixing point rather than only masking. Reduce fight or flight by recognizing triggers and practicing quick calming moves. Commit to short, daily stress reduction practices that fit your life. Challenge negative thoughts with simple CBT-style steps. Build morning and evening routines that deposit resilience into your energy bank. What improvement looks like. Improvement usually means tinnitus feels less intrusive, you react less emotionally, and you can restore focus more quickly when it spikes. Many people describe progress as being able to live around the noise rather than feeling controlled by it. Final micro action for today. Pick one of the 5 reminders. Try the micro action associated with it for 7 days. Take a simple note each day about how you felt and any changes you noticed. Small, consistent steps are what produce lasting benefits. One more time. The right sound can trick the brain into lowering the prominence of tinnitus, but the sound is most effective when combined with nervous system care, daily calming practices, cognitive tools, and routines that build resilience. Tell me in the comments, which of these 5 will you try this week?
If you want structured, step-by-step support, visit puretinnitus.com to learn about guided programs and clinical options. For vetted resources and support groups, the American Tinnitus Association is a good place to start. You've already taken an important step by learning how these pieces fit together. Keep experimenting, keep it simple, and be patient with yourself. Small deposits over time change the balance. I'll see you in the next video.